Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. Okay, so tell me what's going on with your shoulder. What happened?
I went to sports and fitness, and I used the dumbbells, the weights, to get this.
It's like boxing or something like that? Okay.
On the music. And a day later, I got a real lot of
Pain?
pain in
Okay.
my arm. Yeah.
How much pain from 0 to 10? 10 is emergency room.
Now I have no pain, but sometimes when I on massage and I do.
So you are a massage therapist, so
Yeah.
you use your hands a lot, you start to feel pain. At worst, how much pain?
Sometimes an 8.
8.
Yeah.
Okay. How long this been going on?
Half a year.
5 years?
Half a year.
Half a year.
Yeah.
Okay. For this like half a year, what kind of treatment did you have it on your shoulder?
Massage and cupping.
Massage and
Yeah.
cupping.
Yeah.
Okay. Can we aggravate your symptoms now? I want to stimulate the pain. What can we do to make it worse now so we can use that for the evaluation and treatment?
To stretch.
How much pain when you do that?
This pain, the overstretch, it's a 4 or 5.
Where do you feel it?
Can you help me? Because,
Oh, I hear this. Yeah.
yeah,
Yeah.
here,
Here. 4 or 5.
yeah,
What about when you
and
lift
here.
in there?
Yeah.
4 to 5. Okay. Can you do this? Any pain with that?
No,
Can you do this?
no, yeah, no pain.
No pain? Can you do this?
Yeah.
Any pain with that? Thumb up here. So I'm
Yeah,
going
yeah,
over all
yeah.
the range of motion to see if I can stimulate the pain.
I can feel it.
That's painful.
Yeah, yeah.
So 90-degree abduction, that's painful. How much pain?
4 to 5.
4 or 5.
Yeah.
So 90 degrees abduction, that's what I'm gonna use to reevaluate her, okay? And then that's stretching. I don't recommend that stretching anyway, but we're gonna use it for reassessment. Do this and tell me how much pain.
Yeah, 6.
That's went up to 6. So okay, we have 2 motion to use it for reassessment. Okay, so let's actually lie on your back head here. Okay. Can someone? I will have a new gown. Okay. So you feel it right in here, yeah?
No, this
You
arm.
change your mind. It's happened a lot actually. Patients change their mind when you are in the opposite direction. Don't blame it on yourself. It's usually the patient's fault. So right in here.
Yeah.
So you were boxing or?
Yeah.
Oh wow.
Carefully, doctor.
Did you hit yourself?
No, it was with tumbles, with weight. 3 kilo here, 3 kilo there, and then on music.
Okay.
Ja, 12, 15.
Make sure it's not painful, okay? Is that too much?
I feel it.
As long as it's not painful, it's okay.
Yeah.
But now because you took the class, you can tell which layer I'm working on. You see? Like I'm actually selectively go to which layer. You see that?
Yeah.
Okay. Look when I'm doing this. Top. Doing this. Bottom.
Yeah.
Does that make sense?
Yeah.
Okay. So I'm gonna have it like whoever did not have treatment, I will do some maneuvers on you to kind of like visualize what like feel what I showed you in the diagram, which layer of fascia you work on, how much pressure you apply it to get to that layer. You felt it too, yeah? Okay. That's good. How's that?
That's good.
Okay.
Feel it.
She has a lot of tightness. Oh, I can feel the scar tissue here. Really. How's that?
Good.
Okay.
No pain.
Mm-hmm. Okay, I need to get this big one. Okay. And you see the tightness? Look at her head. Because the fascia is one, the superficial fascia, it's continuous. Yes, you can move the head from this because it's one piece. You know. Have you had any head trauma or accident, sports injury in your head?
When I was 10 years, I had a was falling on my head.
Did you have any sutures?
No.
Where did you hit your head?
Oh, I don't know. It was a fall and it was out.
Okay, relax.
And I have.
That's your fascia is really tight. Okay, relax. Okay, so I might come to this, but did you see a question I asked? Okay.
Een hersenschudding, hoe steeds je dat zeggen?
That's not English, isn't it?
No.
No. Okay. Oh, you're talking to her, not me. Yeah. Okay. Okay, relax here. And you're probably gonna feel why I choose this area. Does that make sense here?
Yeah.
Okay, because she feels my hand. And you guys know because I told you in the class. Okay, too much?
No.
Okay. And you just rest here until patients scream. No, do not do that, okay? Don't let them scream. How's that?
Yeah, it's good.
Okay.
I feel it, but no.
You feel pressure?
Yeah, no pain.
You don't feel pain, okay. Okay.
No, it's not, yeah.
Is it painful or it's okay?
The last one was.
The last one.
Yeah.
Okay.
It was enough.
Okay.
Yeah.
You see my hand is rolling
I feel
here.
it, yeah. No,
You see
no
that?
pain, but.
You see that? It's right where she had the band. It's not painful to me now.
That's what I probably ask if acupuncture hurts. I don't feel anything.
I'm good. You can do that all day long. How's that? You're anticipating, are you? You're anticipating the pain?
No, I don't feel.
You don't, okay.
No.
And a lot of patients, actually, you do that and the band is gone. Or the intensity, or the, like, it's a very hard band and it starts to soften up. That's what you're looking for. Like the other day when I worked on you and you said, I don't feel the band, do you remember? You know, yeah, some cases you can get it all released. It depends on how bad is the condition. And that's what determines how many treatment you're gonna, you will have. How's that?
Yeah, I feel them.
Pain or just you feel pressure?
Yeah, a little bit.
Okay, sorry, okay. Okay, so we did this. I don't like this actually. See my hand? How's that?
I feel it.
Okay.
Yeah.
Hij loopt het, hè?
Yeah.
Is that painful?
Yeah, it's sensitive.
Sorry, what about now?
Yeah, it's okay.
Here.
No.
Okay, here.
Yeah.
But do you remember this? This is where the really tight fascia now. You see the hand movement? Yeah.
Yeah,
Oh.
sensitive.
Sorry. What about now?
Yeah.
It's okay?
Yeah.
Oh, okay, here. Okay. Here.
Sensitive.
What do you mean sensitive? Is it painful or just
Yeah,
it's
that's.
too much or it's just the pressure?
Yeah.
Which one?
Yeah, difficult to say.
Okay.
Not real pain, but.
If you feel pressure, that's normal. But if
Yeah.
you feel it's annoying, that's not normal. You feel this one. I probably will have you, not in the video, you're gonna work on her pec.
On her?
Pec.
Oh, pectorinus.
Pectorals?
Yeah,
Pectoralis.
pectoralis. Yes. That's for female therapy, for female patient, because it's all connected. Yeah.
The work from the sternum or more likely only muscle?
I will do the whole thing, but you assess it like where's, you know, if there's no scar tissue, there's nothing to do, you know.
Hmm?
You just do, clean the whole house.
House.
Yeah.
Ah.
Sorry. Okay, and don't scream, okay? We're doing video here. Okay. All right, so I can feel this and she can, you feel this scar tissue here, yeah? Bump, yeah?
Yeah.
Okay. Away from her legs. That's the first lesson in the class. Yeah, don't get closer to the legs. Or the hands. Okay. Let me actually work on the scar tissue here. I think we have, we'll get the lotions on that. Thank you. Thank you. Okay. All right.
The assistant.
She's a great helper.
Yeah. Wow.
Yeah, you can leave that. That's fine. Yep. How's that?
Yeah, it's good.
Yeah,
But
but
I feel that
scar
you're-
tissue.
Yeah.
Yeah, you see this one?
Yeah.
Here you go. You see that? Okay.
Yeah.
So it's right in here. This is a little scar tissue. Look at this. It's deviating the tools. It's going around it. Instead of on the top of it. I'm on the top of it now. Now when I get like this, oh sorry, we get a lot of lotion here. Hopefully I don't get it in my clothes or any of your clothes. Sometimes
said-
like that. Sometimes
It
I
was
get
good for your clothes.
yeah.
Yesterday.
You can wash it.
You
You
said.
can. I said you
Wash it
can.
all out. You said, yeah.
I said you can wash your clothes and it will be
Yes.
okay. But I did not say it's good for your clothes.
No,
you
but
know?
you can wash it and you go out.
Yeah, yeah. I wash it in my clothes. It goes out. Yeah. This
You
lotion.
lied to us.
No, I did not. Do you
We
wanna?
come starts
do you
in
wanna
Holland
see?
and then oh.
Well, I hope you wash it. So you
My
see
man
all the
said,
redness.
What did the Dr. Jacobs with you?
Yeah. We need to get a new clothes now. No, this lotion is actually washable. You know, like you can really get rid of it when you wash. But if you did not wash it, you're gonna see it all the time. You keep staring at it. Sometimes I do it in the beginning of the day and all day long while I'm working on a patient. I'm like, a spot's still there. Yeah. So, is that too much?
No.
But you guys look here, the scar tissue,
It's
because
never
with the other cases, it was spots.
Yeah.
With this case, it's the whole,
Yeah, the whole. Yes.
the whole area. That's a scar tissue. Is that too much? Sorry.
No, but I hear it.
You hear it,
Yeah.
and you can hear it here.
Oh, man.
You hear that?
Yeah.
Hmm.
So I think
And look in this area, she has a scar tissue, but it's not the whole area like here. Look at here. You see it?
Yeah.
So she has a spots here, but it's actually very big, considerably. Okay? And here.
No.
You can
Yeah,
hear
it's
the
so full.
sound. Too much?
No.
You hear it.
Yeah.
You hear that? Okay. We hear it too. We hear you, scar tissue. We hear you. We know you are here. Too much?
No.
Okay, and she has a one here. Okay.
Yeah, there's a whole.
I think it's a big mess.
Well, I don't want to say
You are
anything.
right,
You know, I don't want to hurt your feelings, but you're right.
Feel it.
Sorry. Okay. So you see the mess. Oh, sorry. You see how she's intense, require a lot of work. Don't say the word mess. Okay. Some people do not like that. Say it to them. We all a mess, by the way. It's
Yeah.
not you. If you did not have ASTR treatment to break the scar tissue, I'm not sure what else can break
How did
it.
you find out on yourself?
I know it in myself. Well, you get a scar tissue from
tried it
any
on you.
accidents, any accident. If you did not release the area, there is probably residual scar tissue from previous anything, repetitive strain injury or anything, you know. So we're not immune for excessive scar tissue, unfortunately, you know.
No, but I mean, you have. How did you try it on yourself?
I can do it this way.
Yes, only on the.
And I can do it in my legs.
Yes.
Yeah, was my experiment. What
Yes.
I had a family and friends to experiment on.
Okay.
And that's how I came with those tools with a lot of experiments, you know. So, and I had good patients then. In the beginning of the years, they were just excited to try anything new. So I was like, okay, I redesign it again. Can we try it? Yes. So I had really good time with, you know, having very flexible patient to try different design on them. But yeah, I can do it on myself. I have my wife do it on me. So because you cannot do it in all your
No.
body,
No.
you know. So you need to have someone trained to do it correctly.
Yes.
Because if you're not trained, it's really blind to just use the tools. You know, it's a hit and miss. You feel this one here?
Yeah.
Can you see it? It's really not
I made a
here.
burn.
Yep, yep. You see that? You feel that? Sorry. But the good news, she's smiling. Okay, keep smiling, keep smiling. Patient happy to get the scar, to get rid of the scar tissues. You see, feel that? Okay. All right. So it's time to clean, and I will have you sit up. And can we get her some water? A different bottle than we use it for the other patient.
No new one. It's new.
Yeah, it's new, huh?
Yeah.
So we get you a new bottle. We just use it once, okay? Let's sit up for me and facing this way. Mm-hmm.
Okay.
No. Has it?
So as you guys remember, we had two range of motion that we tried.
Yes.
That was the painful ones. Mhm. Okay. So let's. So the one is this motion. So you tell that was 6 initially. Okay. How it feel now?
0.
0. Okay. So the other one was 90 degrees abduction.
A 1.
1. Where do you feel it?
Yeah.
Okay. Relax. Relax. Okay. So let me get. What is the spray? Okay. Sorry. Can you hold fine because recording? Sorry. Okay.
Wait.
Okay.
Wait.
So you said you felt 1 in here, yeah?
Yeah.
Show me the exact spot.
Okay.
Right in here.
Here.
Okay. Relax. I'm gonna give you injection.
Yeah.
Okay. Not really. Okay. How's that? Relax. Relax. Is that relaxing?
I'm relaxed.
Okay. All right. How's that?
Yeah.
So how long you had? Half a year. Okay.
Yeah.
You said half a year. Okay. So she still have some work to do. You guys gonna work on each other, but the goal is to get the pain under control, just to so she will be function and few treatment of just breaking the rest of the scar tissue, and she should be okay, as long as she does not have inflammation. Does that make sense now?
Yeah.
Okay, let's try it again, and tell me how does that feel.
Here.
How much from 0 to 10?
1.
Can we give her some water, please? Oh, let's
Right.
drink more water, okay? I want you to drink a lot more, okay? Relax. You are relaxing?
Yeah, yeah.
Okay.
Drink more holy water.
Mm-hmm.
Make you relax.
Okay, let's try it again.
It's gone.
Okay. Good. What about, let's test this again. How's this?
Good.
Mm-hmm.
Net shaky.
How much?
Yeah, one here.
One here. Do you need this spot? Okay, good. What I'm doing now? Magna heel. Mm-hmm. Relax. Okay. So it's the same. It's the same spot. So she has inflammation here. So we'll try to get that inflammation. Even though if she said one again, I will be happy. I will just give her the magna heel, because she was 6 on the other motion. It was 4 or 6 on the abduction. So we get it to 1. That's okay. Sometimes actually, patient in a few hours, this is totally disappear. But
After the treatment.
yeah, sometimes actually take 24 hours when you release fascia, so the body get used to everything settle down in the correct position. Some patient actually in 24 hours they feel better, because sometimes if they have a lot of lactic acids or toxics that you release, the soreness is from those toxins you just released. That's why we try to get them the water immediately. How's that? Okay, let's try it again.
Okay.
Mm-hmm. She actually, remember the first time she did this, she did not do twisting.
No.
It was just painful to get to that position. Now she's actually taken it to extreme range of motion, which is really a good sign. She's moving more.
En dan stretchen dan.
And the stretching this way.
I feel something, but here.
What do you feel? Just pulling or pain?
Yeah, pain.
How much?
One.
But can you visualize when she started? She started here and that was painful. Now she go into extreme range of
Yeah.
motion. In here, this. Look how far she's going now.
Yeah.
That's like a lot further. Okay. Make sure you tell me if you're feeling pain, okay?
No pain.
Okay. But remember, that was painful for her. How long have her holding this position now? Longer than the time she had it, you know? So I'm trying to get this spot. Okay, relax, drink a little bit more water and try it again. Okay, try it again. We have more. How's that?
Yeah, I feel it here.
Pain or tightness?
Yeah,
How much?
pain. One.
Okay, I will be happy with that. So she has
Yeah.
inflammation, so I'll give her the magna heel.
Yeah.
So what do you think about ASTR treatment? We just
It
like,
works.
yeah,
It works. Yeah.
it works. Yeah, thank you
Yeah,
so much.
thank you.
Thank you. Mhm. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.